colleagues, it's my pleasure to welcome you to this ESMO Women for Oncology Roundtable discussion. We will have very important topics to discuss together, and I will just chair this discussion with a very nice group of panelists. My name is Solange Peters. I'm the ESMO president and working in Lausanne in lung cancer, but I will have with me Pilar Garrido, who is the chair of the Women for Oncology Committee. She's also working in the field of lung cancer in Madrid, in Spain. Susana Banerjee, she's a gynae oncologist, and she's also a director of membership in ESMO. And she's here also because she's leading many initiatives looking at the professionals in the mission they have, how they can cover their duty through the Resilience Task Force. So she will discuss with us this topic, and she's working in London. And Fabrice André, I think he doesn't need so much introduction. He was the chair of the Precision Oncology Task Force. He's a breast cancer specialist, and he will discuss with us some literature and publication aspects in I would say across the topic of gender differences or maybe gender gap. We are here today together in order to try to understand how these strange times of COVID, these times of pandemic might have affected the professionals and specifically affected women professionals. Susana will evoke it to a larger extent, but as an introduction, she has been running a survey within our group of ESMO members and received more than 1,500 responses to the survey, trying to describe how professionals in oncology have been impacted by COVID. And you will see the vast majority of them will answer that their daily practice, their daily routine have been broken, have been disrupted by the COVID. Unfortunately, when we meet a crisis, we know that that's also a huge risk to trigger an exacerbation, to exacerbate the inequalities which already exist in every topic of the societies, including all the discriminations we know, but including also the gender gap. So this COVID pandemic, and it was a topic of questions in ESMO, was at risk of triggering more inequalities also in the field of gender disparities. We knew from the past and from the work of Women for Oncology that we could see some indicators of an existing gender gap in oncology. Would it be the career path? Would it be the achievements of all the members? Would it be the presence of women in congresses, but also being part of important boards and committees? Would it be also publications? We were in the past also able to show that unfortunately in oncology, and particularly when you speak about clinical duties, women were more rarely than men the first or the last author of publications. We were able to show in the study we made probably 18 months ago that as first author in oncology, only 37% are women. And it becomes even worse when you speak about the senior authorship, where only 24% in the field of medical oncology were women. So already an existing difference before the COVID pandemic. And the question today we will discuss is how did the pandemic influence or impact these parameters? And unfortunately, now there's an accumulation of publications showing that what we feared happened, this pandemic did increase these differences you could see in authorship, and basically it was shown probably now in 5 papers that women did publish less during the COVID times that they were publishing before, exaggerating this difference, but also women were publishing less about COVID. Would it be in preprint or would it be in final articles? Women were less present in all authorship, first and last author. So it's a quite important topic, trying to understand what underlies, what are the reasons why these differences are obviously observed as soon as difficulties are encountered, and how we can potentially prevent them or work on them in order to minimize this effect over time, whatever happens with COVID, but whatever happens with COVID means through the next crisis our societies will have to face. So with this introduction, it's my pleasure to ask Pilar Garrido to let us know what you have been doing, because by questioning this gender gap, the Women for Oncology Committee decided to also run a survey specifically on the gender disparities question during COVID. And Pilar, can you speak to us about it?
Thanks, Alonso. In fact, it's true. The ESMO launched a specific survey about this topic last June. The survey was available for 3 weeks related to oncologists, ESMO member or no ESMO member, and we asked different questions. For instance, apart from demographic, of course, we asked specifically, has the COVID pandemic changed your personal life? Do you think the COVID pandemic will affect to your professional career? What is your ambition? And a third question that I would like to highlight because I think is very important. Have you been invited to be part of one or any committee focused on solving COVID aspect? And then we developed the survey focused on the amount of time dedicated during the confinement and after that, 2 different activities. Did you dedicate more time to hospital tasks, taking care of children, parents, whatever, or your personal care? Less, more time, how much was the time? In terms of the answer, for me was really important. We have 650 people who answered the survey, but 72% of them were women versus only 28% of men. So I will talk about that later in the open discussion because I don't know how to engage men to be part of this. This is not a question of women for women. It's a general question. No? And in terms, and I think is related to your question before, is that more than 50% of men had been invited to be part of COVID committee, but only a third of women. So maybe we don't have this gender view because we don't have women in policy spaces that are needed to have this gender view. So, and of course, as expected, women during the pandemic dedicated more time to hospital tasks and less time to personal care in comparison to men, at least in the ones who answered this survey. So very interesting answer, I would say a little bit sad.
It's interesting because there's something that is obvious thinking about women crossing and faces this pandemic, is the fact that the working force in oncology, if you think about interprofessional working force, is mainly represented by women. Would it be across countries from 70 to 90% of the working force are women in oncology? But also, and we know that at least in our societies, women have also other duties and natural obligations, which is usually also to play the role of caregiver for the family at large. So this fact that they are not invited in committees, do you think it's partially because they don't commit or they don't volunteer to do that? Or do you think there's really something about the selection process which makes it less obvious that they could guide policy, that they are good managers of crisis? So what is your feeling about it? And maybe Susanna and André, and Fabrice, you can also comment on that.
In fact, the question was, has you to be invited? No, have you accepted? That could be a different, I decided not to accept because I don't have time, I need to dedicate my time to children, parents, or whatever. No, have you been invited? So I think it's the second part. This is why I said that we need more women in policy spaces. We need I say women because usually men are not so engaged with this topic as, for instance, the number of men who answer this question. I would like to have more men engaged to this topic because it's relevant, it's very important. It's a common problem for all of us. No, we need different view, but as now I think it's a question of not having women in position in which they can invite or they can decide, okay, this panel only have the view of men, we need women, something like that. So yeah.
In one of these publications, only 34% of all authors of COVID publication were women, with 25 of them occupying the first and the last. So are women less prone to make decisions about policy and management at a time of a crisis? Fabrice?
No, I agree with what Pilar told. The thing, I think, Solange, we have to be careful with the metrics paper. I will come back on this later. Mm-hmm. I don't think it's a good metrics, especially in the time of COVID, where probably 95% of papers were very, very poor quality. Mm-hmm. So I would not take, if I want to be cynical, mm-hmm. I would say it's a good signal that the percentage of women decrease, because the percentage of very poor quality paper has dramatically increased. So I think it's, and I think it's, I would say I would be careful of not over-interpreting numbers from a crisis. Mm-hmm. Especially for me, it has been a crisis of the scientific literature. Mm-hmm. So I would be very careful on this analysis. And then I agree with what Pilar told. I think this topic is going to be transformative when all stakeholders will go on the same way. And it's true that sometimes men don't feel so engaged in this question. And here it's a question of providing men who can make decisions the scientific data showing that involvement of women improve the quality of decision in board, the quality of science, etc. And this data exists. So I think this topic is going to change when we will better disseminate all the data that support the fact that involvement of women, but in general diversity, improve the quality of, it can be decision, science, or whatever things.
Mm-hmm. Susanna, because we did run other surveys for women for oncology, and we always had this 25% of men responding, answering the questions, not more, it's 1 out of 4, something like a ceiling. How do you perceive it? Well, it's not so bad, right? Still, it's 1 out of 4, but any idea about you were part of the Young Oncologists, a very active group. How can we foster, improve that interest around the society topic at the end?
I was very interested in that because I thought that topics like burnout, well-being, for example, perhaps there'd be more female responders rather than participants that were male. And that's why I was very pleasantly surprised at how the Resilience Task Force survey, which was all about well-being and burnout, there was actually 50-50, it was 51% women and 49% men. Mm-hmm. And that's relatively consistent in survey 2. So I do think that men want to engage based on that, in the sense that you can imagine if there was a survey potentially about treatments or about specific oncology care, perhaps the ratio would be about 50-50, but here we saw 50-50. Again, it was sample size. I guess we're very, very fortunate in that sense. I do think that, in answer to your questions about how to have more women involved, mm-hmm. that visibility. So actually maybe something good will come from this COVID-19 situation, because so much has had to become virtual. So therefore, when people are thinking about virtual meetings, virtual hospital meetings, but also national meetings and also international meetings. I mean, I know for one that I'm accepting more events which are US based, because I don't have to travel there at the moment. And I wouldn't think of traveling to the US and taking, X amount of days around a 2-hour meeting or something. So I'm hoping, and I'm positive, and we have to be hopeful, that actually there'll be changes in a positive way that we can take from this COVID-19 period.
As our auditors have understood, we have run another survey, which was launched by the ESMO Resilience Task Force that you lead, Susanna, to evaluate how oncologists and all the oncology professionals were affected by the challenges posed by COVID-19 pandemic. You wanted to assess the changes in daily practice, the well-being, like you said, which looks like to be more a woman kind of topic, but it's not, and the current level of support. And also the final question, what can ESMO do for that? Or can ESMO do anything for that? So you will present this data as an LBA at the ESMO meeting. Can you maybe summarize for us the most important messages and key messages that you got from this very, very large resilience task force survey?
So it wasn't a simple type survey. It actually had a lot of thought behind it. We've involved lecturers in well-being and organisational health and psychology input in this. And it was a collaboration. So Pilar, as part of the Women for Oncology Committee, also input with the Young Oncology Committee, and also the Leaders Generation Programme and OncoAlert. So, but having said that, we looked at well-being using the Wellbeing Index, which is developed by the Mayo Clinic. It has been validated and published extensively. We looked at burnout by asking individuals the question from the Wellbeing Index about if they actually just simply felt burnt out by work. Mm-hmm. And also we looked at job performance, and there are a lot of publications on this already. So what we found was something very important and intuitive, but we showed that actually well-being and COVID-related job performance actually varies between countries, and that's related to the crude mortality rate. Now that's another thing. How do you assess different countries and how can you compare? Mm-hmm. Well, actually, I don't think you can compare, which is why I don't actually say this country versus this country or regions. It's actually all 101 countries across the participants looking for trends, because each country would have experienced a different stage in the evolution of the COVID-19 pandemic, and be at different stages at different parts of when the survey is rolled out. So we opened both surveys for basically 2 weeks, one in end of April, beginning of May, and one 16th of July to the 5th of August. So what we saw, as I said, that COVID-19 crude mortality rate was relevant for well-being and job performance. Incidentally, there were differences between countries for burnout, which isn't too surprising given what we published a few years ago. Mm-hmm. But it was not associated with COVID-19 crude mortality rate, which actually makes sense because burnout is a more long-term, more intrinsic reaction and not something that's going to change from week to week, mm-hmm. whereas well-being can do. So what we also did was multiple regression analyses looking at other factors that could be associated. And although many of the magnitude of the effect sizes are small, they were statistically significant. So if I take, for example, well-being, and that's of relevance to this gender conversation, for well-being, participants with higher levels of perceived self-reported resilience, pleasant working conditions, those who felt valued by their organisation, men, and those aged over 40 reported lower distress or better well-being. Mm-hmm. The converse is true, of course, when you're looking at these associations. So those under 40 and women reported higher distress. And what I didn't present, what I won't be presenting given the time and the wealth of data we have, but what I'll share with you today is when we actually looked at individual answers to some of the questions. We'll be looking at under 40s specifically, not only in regression analyses, but answers for some questions and gender. And so when we asked about burnout, 34% of men versus 42% of women felt that they were burnt out at work. That was with a p-value of 0.001. And then we actually asked, as part of the Wellbeing Index question, have you been bothered by emotional problems, so anxiety, irritability, for example, or depression? And 60% of women versus 45% answered that they felt that way. So that doesn't, we can't really understand why there are these responses, but those responses are different. And I think that's helpful for individuals and organizations to work on that. I don't think there's going to be one factor that overrides everything. I don't think it's just gender. I think it's complex, and there are many aspects that come together, culminating in what Pilar has shown, and the Women for Oncology Committee, under your leadership beforehand, had shown.
The question to you, it's I find the numbers, first of all, impressive, but also extremely worrisome. Remember, we had also this concern when we looked at your first survey about burnout, seeing that young oncologists face this overload on the long run, right? And here you show it again, not only looking at young oncologists, but looking at the oncology community across the crisis, but probably long run, like you say, it's not an acute phenomenon. But more than that, you show the psychological distress. And feeling that the community demonstrate or discloses 60% of distress, if you ask them the question, for me means that the system is probably at high risk of breakdown, right? Of major crises, of people leaving their job, and of course of a society impact. So what well, I remember when we discussed the burnout, some psychiatrists were telling the fact that you only speak about it, you already have done something positive, because it means that you can recognize yourself in a process or in a phenomenon which is not only yours, but is also potentially the consequence of something that everybody is experiencing. So it helps supporting the group as being a group. But what else can we do? I mean, we have the COVID, we have the gender gap, we have the workload increasing, we have people isolated at home for COVID. So what can ESMO do, or what can we do in order to monitor and address this question of burnout?
So the first thing is, I think, is acknowledgement as an individual, and acknowledgement of organizations that there is a problem, that actually well-being is a priority, because it's linked to job performance, and ultimately that's patient care. And that's what we're all here about. Yeah. So I think what this survey is, with all the potential deficits of response bias, it's large numbers. We need more, given this is a global survey, but an important number of oncologists have said how they feel, and we can't ignore that, and we need call for action. So I think acknowledgement. I do think simple measures can also help. Feeling valued by an organisation was something that came up. And I think transparency and good communication from a leadership level in hospitals, institutions, societies can be very important.
So let's go back to a real focus on gender. And Fabrice, well, we historically, we have observed in terms of representation of women that there were differences in the literature, right? As we discussed, it might be that these differences in research and in clinical literature have been even changed or further modified during COVID. You are editor-in-chief of the Annals of Oncology. So what is your take out of this, I would say, conclusions, or maybe too fast conclusion you said before? Is there something we should work on based on these specific COVID times, and in general about women and publications?
So Solange, I think before discussing COVID, very short time, I just want to come back on how publication can be informative for the question of gender balance. So here we are discussing about two very different things, and I think it's important to understand this. The first thing is about original papers. This tells us about representation of women in science. So it's a proxy, it's a surrogate of representation of women in science. And then we talk about totally different things that are invited papers, that are a matrix of whether women at the same level of science are perceived as leader or not. Okay, so we have to make very different discussion. So for the first one, as you mentioned earlier, there are papers, especially one published in Cancer about the literature in oncology, where they analyzed 9,000 articles. And what they show is that when you look at first or last author, from 90 to 2017, we have an increase in the representation of women. In 1990, 17% of the first author were women. In 2017, it went to 36%. So it's still far below the actual number and a percentage of women in the working force, but it's increasing. This is for representation of women in oncological science. Then about whether women are perceived as influencer of or leader. Here, it's a little bit more worrying. we have two studies, for example. One is a case control, one is in a field where 50% of senior scientists are women, and roughly they say that there is an underrepresentation of women for invited paper at the same level of science. So, so here the conclusion is very clear. There is an increase in the representation of women in oncological science. It's still far below the representation in working force, but there is a very big deficit in terms of perception, meaning they are not invited to give their opinion. That is something that I discovered when I work on this topic, and I was very surprised because we have to go deep to analyze what the causality of this question, but the data are consistent. At the same scientific level, it's true that women are less invited to give their opinion. Okay. Now, in terms of how COVID could have influenced this. First, we have to be very careful with two elements. There is a very strong heterogeneity between field of science. So it means that COVID is mostly infectiology, infectious disease. So if in this specialty there is less representation of women, that can explain why the gap increase. So we have to be careful with the number. The second element in terms of number is that it's very difficult to know the gender from the first name of the authors. This is why I encourage everyone who is seeing this video to have an ORCID number. ORCID number allows you to be yourself and not someone else. So to summarize. So then in terms of COVID, indeed, there is a decrease, substantial decrease in the representation of women in the papers during the COVID period, where most of the papers were related to COVID. What is the cause? This is very difficult to analyze, and also it's very difficult to analyze whether it's something that is worrying. Because, you know, as mentioned before, you could also interpret by the fact that men are crazy about publication and can publish things that are very bad. You know, there are many different ways of interpreting this question. I think the question is, what is the impact on the midterm? And here I see two possible impacts. Interpreting data on crisis is almost impossible. So let's see what are the possible impacts. First impact, in terms of perception as key opinion leader. Of course, there are many things that must be worked. My intuition, and this is not based on data, it's pure intuition, is that switching to digital world is going to increase the perception of women as leader. So I think that I suspect this is going to be one of the midterm impact. If tomorrow dissemination is done by digital and there's no longer long travel, etc., it's possible that it increases the perception of women as leader. The second impact is about representation in research. Here, I'm not an expert in social science, and especially on this topic. What I have read is that it seems that because permanent positions in research are extremely under danger because of financial crisis, and because when there is a danger, most of the time it's women who are having the consequence, it could be that a midterm impact of the financial crisis related to COVID could be a less representation of women in the permanent position in research. So I think that that are the two perspectives I can see in terms of papers. Representation of research, meaning original article, we have to be careful because it could be that tenure position, permanent position are going to be affected by COVID. And second, perception of women as KOL, I suspect is going to increase the perception of women as key opinion leader. These are just my opinion as an editor-in-chief. Again, I'm not an expert in social science related to the question of gender representation.
A question to you. You mentioned, of course, about scientific paper. It's the surrogate or the mirror of how many of these women are involved on the long run in high-level science. So that's something which needs time to be changed, because it's about position, it's about something which is built through a career. So of course, this cannot be changed in a day, right? And needs years or decades. But the other point about perception of women, and I would ask you a question afterwards about tenure position, but perceptions can be changed. And there's something you can work on probably before working on the whole structure of the society or of a profession, is changing perceptions. And for that, ESMO societies can change perception, journals can change perceptions.
Yeah.
Lancet has done a lot of work. You've seen this series of paper to change perceptions, because you can manage malax perceptions, but not so much the society. When you speak about losing positions, so that some people might lose financial opportunities and maybe at the end tenure position because of COVID, is it about perception that women are more fragile than men? Why would more women suffer from this breakdown or this reduced number of financial grants and opportunities?
So,
is it again perception, you see?
Let me not go in a controversial discussion, but what I have understood from the literature, again, I'm not an expert myself, what I have understood from the literature is that in a situation of crisis across the globe, so I'm not talking about some specific place, but across the globe, in the context of crisis, most of the time it's women who are more vulnerable to crisis. Again, at the global level, I'm not talking about very specific position. So this is a fact, and it seems that papers have this data. Based on this, we are living a crisis that will have financial consequences, and position, the number of positions open in science are going to decrease, because of course public investment of science are going to be dramatically decrease. So if we make the extrapolation that women are more vulnerable in the context of crisis, again at the global level, if we extrapolate this to this situation of post-COVID, it could be that they are going to have some, I would say that it could be that they are going to suffer in terms of representation in the future position of science. Of course, this is actionable, and it could be that university, we say, oh, we make incentive, we want to have a certain percentage of women in tenure position. But what the data are telling at the global level is that after a crisis, it seems that women are more vulnerable in terms of getting position, getting access to work, etc., etc.
So it would be transversal across this higher senior leadership position, as you know, probably looking at the economic literature around the globe, probably 3% of CEOs are women, 3 to 4, right? With some geographical disparity, diversity. But so it means that some societies will also go into bankrupt, right? Some societies will stop or suffer. So probably this impact you describe through vulnerability and this concept might affect in general senior leadership positions for women. That's what you mean?
Well, I think, I'm not sure senior leadership are going to be affected. I think the problem for us, and what we have to be very careful, are the position at the junior position, because this is what is going to be most affected by financial crisis. And at the junior position, again, what the literature is telling is that this is where this question of gender balance is the most acute. You know, this is where we have to put attention. Then to come back on the question of perception of women as leader, I don't think it's a question of something done on purpose. It's a question of network. You know, we know that, you know, giving leadership to some people is also a question of personal relation, network, and the way we are creating network post-COVID is going to be totally different than what it used to be. And I suspect that we are going to have a better representation of women in network, and that will lead into a better perception of women as a leader.
Susanna Pilar, you also anticipate that at the end of this story, and we hope it's going to be soon, we might experience or see changes which might be considered as being positive, focusing on the story of gender gap and perception probably more than structural changes. Do you have the same feeling that there's a window here for seeing one positive thing through this COVID story?
I think there'll be many. Hopefully there'll be more than one. So in the second survey, we asked the question, what can be done to help you or your colleagues? And the highest response, with 86% on a Likert scale of strongly agree or moderately agree, thought that would be helpful, was flexible working hours, basically. So flexible doesn't necessarily mean less. It's just different ways of working. And I actually think, like I mentioned earlier, and obviously Fabrice has, that may lead to many more different opportunities. It's about visibility. And I think, again, getting through COVID, it's about communication and visibility from a leadership level. So even though, of course, we're in difficult situations, self-isolating, and obviously less face-to-face meetings, you can still do Zoom, or you can pick up the phone and just make your team know that you're around. I think these things make a difference. Psychological resiliency came out across well-being, burnout, and job performance as a factor that was consistent across. Now, intrinsically, many oncologists may well have, compared to the general population, there was a publication about that recently, showing that the level of resilience was higher. But even amongst that higher resilience, there'll be a spectrum. So resilience training may be part of a multi-system solution approach, and also access to well-being support. Now, the access has increased in this survey compared to the Burnout survey, which was carried out a number of years ago now. And I know we were looking at under 40-year-olds, and this is obviously not age dependent, but it looks like access is better. But whether people are taking up the access for support is a different matter. There won't be a one-size-fits-all approach, just like cancer care. So we need to be able to adapt to different backgrounds, different circumstances, different countries, in order to have actions, as you asked me before, both individual and organisational. But I certainly think there are positives that we must take from this pandemic.
Pilar, your opinion about it? What can be the consequences long term, and do you anticipate any kind of positive trend or positive change in diversity, right?
Yeah, I'm quite skeptical about that. Sorry, I am not really sure. I see the potential benefit of avoiding so much travel could be a benefit for women, but apart from that, I am not sure, because as Fabrice said, in general, in crisis, women are more vulnerable, are more fragile. So I am not sure about a great future in this topic, but I am absolutely sure that the only way of modulating that is by providing data, numbers, objective things that can help us to disseminate this message. Because as Fabrice said, when he started to look at that and show the numbers and figures, he realized that something happened. So we need to provide the data, we need to collect information, because it's the only way to say, hey, this is happening right now. But if we don't do that, I am not sure, but by nature will change. I am not.
Thanks a lot. I think, unfortunately, we're running out of time, but you have stressed the fact that Women for Oncology Committee will have to continue to look at, analyze, and describe what numbers are over time. I invite you to listen to Susanna's and group efforts looking at the data of the Resilience Task Force survey, the first, second part, and the next parts to come through the publication, but also through the ESMO session. I hope the discussion will be very lively and controversial in order to bring all the aspects on the table and this to be debated. And Fabrice, thanks a lot for your insights about how can literature be a tool, or also sometimes somehow an indicator of what's happening in the society, with some caution in this analysis. And we'll continue to work, of course, as ESMO and with Annals in order to be able to convey as much as possible the scientific messages around gender gap. So thanks to all of you. And I hope it was interesting for everybody listening to us, and we look forward to meet you at least virtually, but probably through questions during the ESMO meeting. Thanks a lot. Have a good evening.
Thank you.
Bye.
Thank you.